Skin cancer is on the rise. Many, many years before patients come in, they were subjected to the ultraviolet radiation of the sun. They were an adolescent, they were a teenager, they were a young adult and had several blistering sunburns, possibly or not, but it could take 30 or 40 years later or more to develop their first skin cancer. And we're not talking about melanoma. We're talking about basal cell skin cancer, the number one skin cancer, and squamous cell skin cancer. So if these are on the face in certain areas that are more prone to recur after a typical standard treatment, something that's burned off or scraped off in the doctor's office or even cut out surgically, way back in 1936, Dr. Frederick Mohs invented Mohs surgery. It is the most curative way of forming non-melanoma skin cancer while preserving as much of the good skin as possible. He was a genius to conceive of the technique where we look at 100% of the true surgical margin, not a sampling. Therefore, we can do this with a more narrow margin. The difference is we don't send it out to a laboratory and get a result a week later, informing our patients that we might have to remove more tissue. It's analyzed while our patients are waiting in our comfortable waiting room and could take an hour or so in between stages to identify if there's more to do. But we know exactly oriented where we would have to trim a little more. It's done with local anesthetic. People are comfortable. And we take a little more, we bring it back to the laboratory, we section it, we stain it, and we analyze it right here under the microscope. We keep going till we get it all. And in the end, we have a less than 1% chance of that basal cell skin cancer coming back with the smallest hole possible. And then we do the reconstruction to provide them the least noticeable scar. And we have lasers that can make scars better if needed.